Welcome back to NoiseFilter, where we dig into the news that actually matters, especially the stories that might have you reaching for the hand sanitizer twice as fast. I'm Dr. MarkAlain Dery, and today we're talking about a threat scarier than your uncle's Facebook post, and that is multi-drug resistant superbugs. My uncle has terrible Facebook post. And before you think I'm being dramatic, let me introduce you to the latest CDC updates. Yep, the big dogs over there at the Centers for Disease Control and Prevention just sounded the alarm again. Every year, over 2.8 million Americans get hit with an infection that laughs in the face of antibiotics. Just today, I saw a patient with a multi drug resistant organism in the hospital. So these aren't just the common colds with an attitude. These are bugs so tough that some miracle drugs don't stand a chance. The annual death toll, well, that's more than 35,000 people in the US alone. And the global forecast, well, if we keep slacking, it's 10 million deaths per year by 2050. And that's like the entire city of New York City gone in a single year. So let's break down the CDC's big findings. And trust me, you'll want to listen close before your next hospital stay. So, point number one, our hospitals are basically bacterial gyms. Ugh, that sounds disgusting. All right. The CDC's new data shows that hospital superbugs like carbapenem resistant Enterobacter, Candida auris, ugh, that's a terrible fungus, and MRSA, methicillin resistant Staph aureus, and more have skyrocketed since the pandemic. Long stays, overloaded systems, and staff stretched thinner than a hospital issue pillow did the bugs a huge favor. They multiplied, mutated, and staged a bacterial CrossFit competition right under our noses. Candida auris, named after an organism that first came out of an ear in Japan, weirdly enough. You probably have never heard of it. It's a fungus, but not add to the salad kind. It's up nearly fivefold since 2019, and that is quite literally the stuff of nightmares and Netflix specials. So, point number two, our precious antibiotics are going the way of the dodo. Those classic antibiotics, penicillin, augmentin, unicin, zosyn, ceftriaxone, these bugs treat them like tic tacs. Simple routine infections like UTIs, pneumonia, even cuts and scrapes can now spiral into deadly threats because the bugs have learned all of our tricks. Hospitals are spending a jaw dropping $4.6 billion a year just to keep up with the cost of treatment for these dangerous infections. And point number three, COVID did us no help whatsoever at all. Remember those dark pandemic days? COVID-19 just didn't just wreck the economy, it broke our infection control routines. It led the way to more, not fewer, antibiotic prescriptions, lack of staff, out of whack priorities, and desperate times made hospitals into germ free for alls. And the result, rates for almost every major resistant bug shot up and not have come down, and they have not come down. So, some things that you can do and should honestly do. One, please stop begging for antibiotics every time you sneeze. Not every cough needs a Z-Pack. Trust your healthcare team, and please stop popping pills just in case. The bugs are winning that battle, folks. Number two, demand action and funding. Want fewer people dying of routine infections? Support public health funding. Support hospital infection control programs and support research into next generation treatments. Tell your representatives if they slash CDC budgets, you'll remember that at the polls, especially if you survive your next trip to the ER. Lastly, wash those hands and wash it like you mean it. Soap and water, 20 seconds, sing the happy birthday song. You know the routine. It prevents the spread, it keeps you out of the ICU, and makes you less likely to headline a CDC report. Okay, to sum it all up, the CDC's last, I wish, no, take that out. The CDC's latest, not last, the CDC's latest report should terrify, motivate, and hopefully make you laugh nervously enough to click share. Superbugs are not sci-fi. They're thriving in hospitals and communities right now. The death toll is higher than a packed stadium, and the bugs are not only getting started unless we wise up and act. This isn't just a science problem, it is a keep your loved ones alive problem. This is Noise Filter. I'm Dr. MarkAlain Dery, and if you don't like the news, make some noise. Just don't touch anything until you've washed your hands. Peace out, y'all. End all wars.